There's two phenomena they talk about, okay? One is, they say it's called, that provides resistance, that is called alveolar vessel, and then extra alveolar vessels, okay? They divided that into based on the locations of the vessels, okay? And when we say the alveolar vessels, we have to talk about a couple of things here. Let's just make here, I'm going to make this alveoli vessels, okay? So what is this? There's a pulmonary right here. We'll make this as, okay, I'm making this across, like, let's just make the airways right here. Let's say 1, like this, let's just 2. We'll make it like, okay, like 3 here, and we'll make it 4 here, right? And then what happens is that these blood vessels are going down here, look, like this. And we'll make like this, okay? And then we'll make this one right here. Okay, and they're coming down here. Okay, look. Now, this is my airways IG, right? Okay, the couple of things is that whenever we talk about the alveolar vessels, okay, they're within the logo. That means that's around those alveoli. These are air sac, right? That's what I do. Now, alveolar vessels, or you can say intraalveolar vessel. Whenever we talk about alveolar vessels or intraalveolar vessel, we're talking about the pulmonary arterioles. Okay, we're talking about the pulmonary PUL, pulmonary capillaries, and maybe we're talking about the pulmonary venules. Okay, that's what alveolar means. Extraalveolar vessels, which means that we're talking about extraalveolar vessels, means we're talking about pulmonary arteries and maybe pulmonary veins. Okay, these alveolar vessels with the pulmonary arterioles, pulmonary capillaries, pulmonary venules, actually, they are deeply affected. This is a very important concept. Okay, they are affected by your alveolar pressure. Okay, we'll talk about what does that mean. And then these extraalveolar vessels are affected by my intrapleural pressure or pleural pressure. Okay, we'll talk about what is that. And right now I'm discussing about the relationship between the pulmonary vascular resistance with the lung volume. That's what I'm discussing right now. Okay, I'm discussing about lung volume with the pulmonary vascular resistance. Okay, does the increasing or decreasing lung volume, does that gonna affect these vessels? But remember one more thing though. Your pulmonary vascular resistance, or what happens is that the pulmonary vascular resistance are very, very low during your functional residual capacity. Okay, let me repeat this again. Your at the level of functional residual capacity, okay, your pulmonary vascular resistance is the lowest. Okay, the reason why is that we'll talk about. And if you are trying to take inspirations or expert, like if you're going above your FRC, okay, or if you're below your FRC, okay, if you're trying to do that, then what happens is that your pulmonary vascular resistance will increase, and we'll talk about the why. It will make more sense to as we discuss about it. But remember this though. It's just that what happens that whenever you, okay, let's just quickly talk about it. Whenever in normal condition, what happens is let's write it down here. Whenever what happens is, okay, let's just make this airways right here. A couple of things, okay, and we'll make this 4 airways, because what happens is that normally there are these vessels. Let's say these vessels are what? My alveolar vessels, and we'll make in a different color this one. This is my extraalveolar vessels, okay? So what happens is that if you at the level of FRC, functional residual capacity, okay, which is your expiratory reserve volume plus your residual volumes, right? At the level, what happens is that, okay, let's say whenever you take, when you take the air in, what happens? Your diaphragm contracts, right? It increases your thoracic cavity, right? That means there will be change in alveolar pressure, correct? That means there will be change, and then also there will be a change in intraalveolar pressure, right? Because of what happens is whenever the air comes in, what happens is, look, whenever air comes, because normally what happens is when the air comes in, okay, what happens is that this alveoli get stretched out, right? They get stretched out, and when they get stretched out longitudinally, what happens is this internal diameters of this what? This alveolar vessel get a little compressed, okay? But it doesn't get like, you know, but it just get a little bit. And then this extra alveolar, because there's no airways, anything around that, so this gets dilated, okay? This extra alveolar vessel becomes dilated, because remember, whenever there is a pleural pressure is more negative, what happens is that those pleural pressure being negative, it causes this blood vessel to dilate too, okay? Now, because of that, what happens, your pulmonary vascular resistance goes down, okay? Because the pulmonary vascular resistance goes down. But if you, let's say, if you go above FRC, meaning that if you increase, like if you're trying to do like, if you're above FRC, you're trying to like take the air in, let's say. So that means what happens, you're going to stretch above the FRC. Let's just write it down. Okay, what these are passively, you can actually increase the resistance, okay? So let's just write down that, okay, where should I write down? Okay, let me write it down here. If you are above your FRC level, then what's going to happen is that, look, these blood vessels right here, you see, these intra-alveolar vessels will get compressed, because these are going to get bigger now. If I make diagrammatically right here, so this guy's right here, which is going to get bigger right here. When they get bigger, what happens is that they are going to compress these vessels which are within them, right? Because this alveolar gets stretched out, gets bigger. So when they get bigger, let me draw the bigger, make it bigger down here. Okay, let's draw this. The alveoli, you take the dip, it will compress like this. So because of what happened, the diameter that decreases, right? The internal diameter decreases, and it is getting compressed, right? Because of that, remember, our resistance is equal to what? Your resistance is equal to, let's say, 1 over R4, right? So your internal diameter goes down, okay? Goes down, that means my pulmonary vascular resistance will go up, correct? That's right. And this is for the, and during the inspiration I'm talking, this is during the inspirations, okay? During the inspirations right here, above the FRC, I'm repeating, that's what happens, right? The pulmonary vascular goes up, and the reason why it goes up is because your alveolar vessel is compressed, okay? It's compressed, but remember, at that time, your extra alveolar vessel, remember, this extra vessel is what? It's not going to compress, it's not going to get compressed, but actually it's going to get dilated. So for the extra alveolar vessels, what happens? The resistance goes down, because remember, as I said, whenever there's a negative pressure, pleural pressure, that pleural pressure causes this air to, like, because when you're getting expanded, because there's nothing is compressing, right? It causes this blood vessel to dilate, okay? Now let's talk about you decrease or you're below the FRC. What is going to happen? Okay, when you're below the FRC, meaning you're trying to compress, meaning that your lung volume is low now. This is like higher than lung volume. This is lower than lung volume, right? I'm talking about normal, okay? No, lower. So because of if you're lower than FRC, then what's going to happen is like, look, you're trying to exhale, but you're compressing. What happens? When you compress, usually what happens? Everything goes down, right? Everything goes down. So everything goes down, right? So we'll compare this extra alveolar vessels. Okay, what happens? The pleural pressure, remember, pleural pressure, if it's negative, it favors this extra alveolar vessel, right? Meaning it will cause dilate. But if the pleural pressure is going to get positive right now, that means, and then also what happens, this, when you try to squeeze it out, squeeze lungs out, what happens is these vessels, okay, extra alveolar vessel gets compressed. Okay, so your extra alveolar vessel get compressed, okay? So let me just write down your extra alveolar vessels gets compressed, right? When the extra alveolar vessel gets compressed, what's going to happen? Resistance goes up, right? So in that case, your PVR also goes up. Look, now, but what is going to happen to my alveolar vessels? Remember, the alveolar vessel is compressing, meaning this airway is getting smaller now, right? This airway is getting smaller, and this vessels was already compressed. That's going to go back to the normal level. So the alveolar vessel will get, the resistance will go down for the alveolar vessel, but the extra alveolar vessel resistance will go down. So resistance will go up for the extra alveolar vessels, right? Which means this is, okay, well, this is radius, right? So this is radius going down, I said. Okay, when the radius goes down, and this is also obviously the radius is going down for the extra alveolar vessels, so because of that you're going to have an increase in pulmonary vascular resistance. Okay, so basically what I'm trying to say is that if I make a graph right here, okay, and if I say, okay, this is my FRC level, okay, if I make a look, sorry, this is FRC level right here, and if I make the resistance here, if I have a, let's say, if I have above FRC, okay, anything above this FRC, then my resistance will go up like that. That's what I'm saying. Okay, same thing with if I below FRC, okay, then my resistance also go up. So graph will look something like that, like this. So basically, if you have, it's just like at the FRC, only at the FRC level or best your resistance is the pulmonary vascular resistance the lowest. But above the FRC or lower the FRC, you saw the reason why the pulmonary vascular resistance goes up, right? Let me just repeat it. In the FRC, is above, if you are above the FRC, then it's the alveolar vessels, the intra-alveolar vessel get compressed, and because of that pulmonary vascular resistance goes up. But your extra-alveolar vessel, that time the resistance goes down because nothing is compressing that, okay? Because there's no alveolar nearby that. And then during the FRC, okay, below the FRC, also the vascular resistance goes up. So if it goes down, then what happens is that this vessel, the extra-alveolar vessel, gets compressed because you're trying to compress through that. But this airways, which was already stretched out, they will kind of like go back to their normal position. So that way, this alveolar vessel, which is within that, will kind of get dilated out. Okay, that's what happens. What else? Discuss it. And these are passively actually affects your pulmonary vascular resistance. Is that what else it affects it? Remember, what is my PVR is equal to? PVR is equal to what? 8NL over the pi R4, right? So that is what it means. So that means, look at this one. Look, guys. What is this N means? Viscosity. If I increase my viscosity, what is going to happen? If I might increase my viscosity, right? Because my blood becomes thickened. So what's going to happen to my pulmonary vascular resistance? Look, your viscosity, is directly proportional to my pulmonary vascular resistance. So if I might increase my viscosity, because blood becomes thicker, that means the flow is going to be decreased, right? That means I'm going to have a increasing resistance too. You see? Now, what else? What else can? Guys, what about the interstitial pressure right here? Look, if you have interstitial pressure more positive, what is going to happen here? Let's say if interstitial more positive, that means if my interstitial pressure is positive, that means what's going to happen? That means it's going to provide more resistance, right? Because maybe the fluid can, if this is more positive right here, interstitial pressure, that means that's going to cause the pleural pressure to go up too, right? So because of that, what happens? You could also see the increase in pulmonary vascular resistance. Okay. What else? What else can cause the pulmonary vascular resistance to go up? Or like, let's talk about, what about the gravity? What is the gravity? Does the gravity play a role? Yes, gravity plays a very, very important role, right? Look, the reason why the gravity is so important here is because, remember, your systemic circulations are combined to your pulmonary circulation. Pulmonary circulation is what? It's a low pressure system, right? Let's say low pressure system, all right? And other thing is that it is also low resistant, right? Is because of the low pressures, and low pressure, what happens? The flow to the pulmonary, pulmonary, let's say vasculature are susceptible to the gravity influences because of pressure, because of this low pressure system, right? And whenever you have, and what does gravity does? Whenever gravity sort of like pushes, right? When the gravity comes, if you're in a prone position, gravity pushes, right? The gravity pushes, and whenever diaphragm contracts, so it is pulling this down, and then also it is pulling this one, so it's pulling like this, right? So like airways, they're on the upper zone here, because remember, if you divide lung has 3 zones. These are called zone 1, zone 2, and zone 3. These are apex, base, and middle zone, right? So everything gets pushed out, right? So because of what happens, the airway becomes very, very large, and this one becomes a little smaller because the gravity is also pushing it down, right? So because of this, what happens? Airways, these ones right here, they're more what? They're more compliant. Okay, so, and also blood vessels are going a lot more embedded down here. What happens is that there'll be good exchange happens at the base actually. So the gravity. So when that gravity, what it does is the gravity decreases your pulmonary vascular resistance. What else that decreases the pulmonary vascular resistance. Guys, you have to remember what is this? Right heart. What is right heart is pumping out? Cardiac output, right? Whenever cardiac output goes up, meaning what? You have an increase in large blood volume, right? When you have an increase in large blood volume, let's say, or increase in cardiac output, right, on the right side, increase in cardiac output, okay? Whenever you have an increase in volume, increase in cardiac output, what happens is, look, in the lungs, if let's just quickly make this here. In the lungs, what happens is, let's just make here. In the lungs, normally what happens is that, okay, there are a lot of these capillaries. Let's just make this as capillaries here, right here, okay? And what happens is that here, these lungs have, like, let's make this as a capillary right here. Usually like this, you have this, okay? And then you have like this. Sometimes like this. Like this. So you see, like, you know, here, like, look, the capillaries, because of blood flow, these are a little distended and they're a little more compliant. But here, as you go here, look, you see the capillaries, some of the capillaries on the upper zones or maybe the middle zones, they are less, they are, like, let's say this one, let's say even non-functional. It's not even, they were not working, they were impaired. Okay, but because when you have an increased cardiac output or increased flow, what happens, there's a term they use, this called capillary recruitment. Okay, capillary recruitment happens whenever there is a increase in cardiac output or increase in blood volume, or even when you have increase in what this pressure, which is my increase in my mean arterial pressure or my right arterial pressure. This pressure, whenever this pressure goes up, which is my my pulmonary pressure goes up, like, you know, that one. Pulmonary, let's say pulmonary artery pressure goes up. Let's write down here. Whenever you have pulmonary artery pressure goes up, or let's say even here, if you look, what happens if your left arterial pressure goes up too? Even in the left arterial pressure goes up, what happens is that increase the volume, what happens is there is something called capillary recruitment happens. Okay, capillary recruitment happens. So capillary recruitment causes what? That means the capillaries that were previously non-functional, they started functioning. Okay, they started working. They started working when they received the blood. And because the capillaries in your pulmonary system, they're thin. Okay, because they're going to become more compliant or become more distensible. You have to remember these two terms. Okay. So there's a capillary recruitment happens, okay, and then the more distensible happens. And because of this, what happens is that this is going to change it now. Okay, this is going to change it, and then it's going to change it and make it like this. Now let me just make this graph. And then because of it's non-functional right now, all this, right? And even so, what's going to happen is that this will become. Let's make this as it's going to get a little bigger now. It's going to be like this. It's going to be like, and this is where non-functional. It will be functional started, and you'll see like this. Okay. It will see something like this. All right. So this is called, the whole idea is called capillary recruitment, and because of more blood, they also become distensible. This whole phenomenon is called capillary recruitment and more distensible. Okay. Now these are so far. What about I'm talking about this pulmonary vascular resistance based on long volumes and all, right? Now, this is all these things that I talked about so far. These are passively affect. But what about, is there other method that you can affect your pulmonary vascular resistance? Yes. Like whatever. Like if I give you some kind of like a sympathetic. If I activate my sympathetic systems, like for example, if I give norepinephrine or epinephrine on my blood vessels, right? What's going to happen with the beta agonist, beta 1? What's going to happen? That's going to cause contractions, right? Contractions. Well, let me just write down quite a few things right here. What should I write down? Okay, let's erase down here. Okay, let me just write down here. Okay, so if I give like active right here, right? If I give, okay, like here, let's just erase this one and write down like, if I increase like a sympathetic system, right? Sympathetic system with this, I give norepinephrine, right? Or epinephrine, right? That's going to cause, what is that going to cause? Any smooth muscle cells of my blood vessel, that's going to cause contractions, right? When you contract, what's going to happen? When you contract, what's going to happen? That's going to decrease the diameter of the blood vessels, right? That's going to create the pulmonary vascular resistance to go up, right? What else? What else can increase my pulmonary vascular? Oh, what about histamine sort of a products, right? That's going to irritate, right? That can cause a bronchoconstrictions or so, which will also decrease the. Actually, it's not the histamine, but sorry for that. But there are other things that could be playing role into this constrictions of your blood vessel. We're talking about blood vessel right now. Guys, remember endothelin, right? These are powerful constrictor. What about thromboxane molecule? Okay, these are some of them. They are powerful vasoconstrictor, right? They will constrict and they will decrease the diameters of pulmonary vascular resistance. And when that happens, what happens is that you're going to decrease. And as I said, histamine also play a role. What about angiotensin and Gen 2? Angiotensin also plays a role into the primarily vasoconstrictor, right? You also, if you want to remember, like, there's the prostaglandins, like prostaglandin E2. Okay, this one also play a role into increasing powerful vasoconstriction. Okay, but what about what are the things that could actually lower the powerful this pulmonary vascular resistance? Okay, we have to also talk about that one, right? So let's just write it down somewhere down here. Let's write it down. Okay, let's talk about here. Okay, how do we lower your PVR, right? Actively. Okay, if I give what? If I give parasympathetic, right? Parasympathetic. I'm talking about the vascular resistance. Okay, parasympathetic, like acetylcholine release, right? That's the thing. What's the other thing? You could see. What about this nitric oxide? Remember, nitric oxide is a powerful vasodilator, right? What about this prostaglandins, right? But it's not E2 though this time. It has to be prostacyclin, PZI2, right? It has to be a prostacyclin, or maybe a prostacyclin. It's just this one is different. What about this other one? Nitric oxide. You have a parasympathetic. Anything else? Oh, you have what about bradykinin? Bradykinin is very important role. This one plays a vasodilation. What about any other things that is actually going to decrease your pulmonary vascular resistance? We talked about in systemic, right? We talked about this, all that kind of stuff. Now, one of the things we also have to look at is like, somehow we've been talking about the vascular resistance, right? Let's talk about, what about during hypoxic conditions? Like, let's say regional hypoxia, okay? Or let's say you have alveolar hypoxia, right? Because remember, one of the things that difference between pulmonary vascular resistance, systemic vascular resistance is like, let's just talk about quickly that whenever there is a hypoxia, right? In your pulmonary vascular, let's just make this is one. Okay, let's just make. Okay, we'll just make this as one alveoli, and then we'll make this as another alveoli, right? Let's say there is a hypoxia. Okay, whenever there's a hypoxia in pulmonary vascular resistance, what's going to happen? Whenever there's the pulmonary hypoxia, what's going to happen is that and what is going to happen in systemic vascular resistance during the hypoxia? In the systemic vascular resistance, what happens is that, okay, what is hypoxia? Hypoxia basically means, okay guys, let's define what hypoxia means. Hypoxia is different than having oxygen level, like low oxygen level in your blood. Okay, that is called that is called different things. Okay, it's called hypoxemia. This means, hypoxia means that you have a low oxygen or low oxygen in the blood. The partial pressure of oxygen is lower. Okay. Hypoxia means is that your tissue is just that the delivered to the tissue, the oxygen delivered tissue is impaired. That is hypoxia. Okay. So if you have a hypoxia, regional hypoxia, that means what's going to happen is that you're somehow, like, one of the things that it could be because nitric oxide may not release, and some of the nitric oxide will not release, and what your vasculature, what it does is that it will constrict this. Okay, so basically once it constricts, the blood vessel will get constricted. Basically, okay, if this is hypoxia, means like what is oxygen level is low here, right? Right? The oxygen level is low here. If the oxygen level is low, what's going to happen is a blood vessel that is coming down here. Okay, what do they do is like, okay, if it's already low ventilated, what your pulmonary circulation does is that there are these, like, in the endothelial cells, they have those the oxygen sensitive channels or so. Okay, they have those oxygen sensitive channels, and they'll react in a certain way that they'll also cause to constrictions of these blood vessels. Okay, so in this area, this was less ventilated, they also make less perfused. Now it makes also, so less ventilated and also makes less perfused here, and if the other alveoli are working, then then the blood vessels will divert to that direction, so as the air would also also the oxygen will also divert to that direction. Okay, that's what happens. So during the hypoxia, what happens is that by doing this, by constricting the blood vessel, what happens? It causes increase in pulmonary vascular resistance. So that's a good thing too. Like, because remember, if it's already low ventilated, because of low oxygen, this the blood vessels also gets constricted. But if you talk about systemic circulation, what happens is that if there's a low oxygen right here, okay, and go into the tissue, well, tissue produces all those metabolites, right? Like adenosine, one of the things, right? Like adenosine, or like H plus, right? Carbon dioxide, right? Especially H plus adenosine, right? And because of that, what happens is that these tissues, or lactic acid too, right? All this lactic acid is, because of that, what happens? The tissue, these arterioles will vasodilate. So it would decrease the resistance. That's one of the difference between systemic vascular resistance and also your pulmonary vascular resistance. During the hypoxia, okay, your blood vessel gets constricted, your PVR goes up, and I just explained the mechanisms, right? But in a systemic, what happens is they'll cause a vasodilator. So that means that we want to have the increase in blood flow, okay? Same thing with that. If you have alveolar hypocapnia, meaning like increase in like a PCO2 too, okay? Even in that case too, like usually you get to see that in dead space, which basically means is that usually you get to see that in dead space. Which what does that mean? Is basically that these alveoli are completely ventilated, right? Like there's 100%. Like what happened? Let's say the alveoli is completely ventilated because of perfuse. There's some kind of problem here on the perfusion side. Because of that, okay, maybe because of that, really what happens is that there's a lot of wasted air there, okay. A lot of wasted air there too, right? And then a lot of wasted air there. So this phenomena we usually call them as like a alveolar dead space or so. So even in that case too, that means this might get diverted towards where there is actually other alveoli are actually functional or working, okay? Working. In that case, they will also try to like constrict this so that way this doesn't get ventilated too. So even with that too, there will be increase in pulmonary vascular resistance, right? Because remember, whenever we talk about pulmonary vascular resistance, there are constrictions of your blood vessels. That's what we're talking about here, right? Even all these conditions, that's you're going to have the high level of CO2 will cause the pulmonary circulation here to like constrict. But if you talk about the system circulation, it will cause it to like dilate, okay? Now, we talked about this, we'll talk about the hypoxia, we'll talk about all these things, right? Now, so far, I think we talked about a lot of different things. I hope that I made it very clear to you guys. We'll just like end it here for now, and then we'll talk about like bronchial circulations and also like pulmonary circulations, and with the different zones. There are different zones in our next class. Okay, thank you.